Let me just start by noting that 9 days ago, we had an election that drew record numbers of Americans to the polls, that offered Americans a stark contrast in who they want to lead the nation going forward, that drew extraordinary interest around the world, and that resulted in Vice President Joe Biden becoming President-elect Joe Biden. Our plan today is to discuss some of the ways that that election will impact the health and public health systems here in the United States and around the world, because that election will have global implications, and to really have a back and forth conversation with each other and with you about these topics. Here's how we're gonna spend our time the next 75 minutes that we have together. In a minute, I'm gonna turn it over to Ross Fromer. Ross, who is the Vice President for Government and Community Relations here at CUIMC, is gonna start off just by giving us an overview of the results of the election, sort of what happened. I mean, I'm sure many or most, or maybe even all of you spent hours last week watching the votes come in from Arizona and Georgia and Nevada and Wisconsin and Pennsylvania on sort of a minute by minute count. But where are we now? Where do things stand in the presidential campaign, in the congressional campaign, and if there are any interesting items at the state level that we ought to know about? I'm then going to moderate a conversation among the five of us, which is going to cover several topics. We're going to talk about the impact of the election on the COVID-19 pandemic, on climate change and the environment, on the quest to ensure that all women have access to an affordable reproductive health services, including an abortion, on the quest to make sure that all Americans have access to affordable and high quality health care, on the need to confront and respond to racial justice and deeply rooted racial disparities in our healthcare system, and on academic medicine and public health more generally, and what does the future hold for us in a Biden administration. What I'll do is I'll probably start out with each of these questions by directing the conversation to one of the panelists, but then I'm going to encourage each of the panelists. We'll take maybe 10 minutes or so for each topic, for the panelists to have a little bit of back and forth among ourselves. I'm also going to hope that all of you, the audience, will be engaged and participate in the conversation. We're probably going to take the first 45, 50, 55 minutes or so for this sort of, roundabout conversation between the five of us, but then we're going to open it up to questions from the participants. You can post your questions on the Q&A feature on the Zoom link. All right, that's the game plan. Let me just give a couple of brief introductions of people who I think most everybody on this call probably knows or should know, because it's quite an all-star cast. As I mentioned, Ross, Vice President, Government and Community Affairs at CUIMC. Wafa El-Sidar, and again, one other thing, with each of these, I'm basically just going to give titles right now. If I read the bios, and the impressive credentials of everybody on this panel, I'd spend 45 minutes just reading, credentials of people, because all of the folks here have an enormous impact on public health and health policy more generally. Wafa El-Sidar is a university professor of epidemiology and medicine at Columbia University. She's the director of ICAP at Columbia University and the director of the Global Health Initiative at the Mailman School of Public Health more generally. She also is the leader here at Columbia University of leading the task force, the university task force on the COVID response. Terry McGovern is the Harry and Robert Heilbrunn Professor and Chair of the Department of Population and Family Health. She's also the director of the Program on Global Health Justice and Governance here at the Mailman School, and again, a leading figure nationally and internationally on issues of reproductive health and more. Jeff Shaman is a professor of environmental health sciences. He is a world-renowned infectious disease modeler whose models have been used by government officials and folks in the media around the country, if not around the world, to sort of chart the path of COVID-19. But he's also, in addition to that, the lead or the director of the Climate and Health Program here at the Mailman School. So with those brief introductions, Ross, could you get us started? Just give us an update on what happened And where do we stand in this 2020 election that we've just gone through, or that we're going through right now still?
Sure, and thanks, Michael, and thanks everybody for having me here today. Very much looking forward. So, as Michael mentioned, we're 9 days since the election, and I think we have a pretty good, although not complete, idea of how things are going to turn out. Just checking a second ago, where we stand in the popular vote, 50.8% to 47.4% in favor of Vice President, now President-elect Biden. That's 77.7 million votes to 72.5 million votes. The 77.7 million votes that Joe Biden got was the most in United States history that anyone has ever gotten for president. The 72.5 million votes that Donald Trump got was the second most votes that anybody's ever gotten for president in the history of our country. So turnout was very, very high this year, above 66%. It's a percentage, but it's the highest turnout election we've had in over 100 years. I should note that 5.2 million vote lead that Biden has, a little less than 5 million of that actually comes from California alone. Biden won California by almost 5 million votes. And like I said, his overall lead is 5.2 million votes. So although he won the popular vote by a fairly substantial margin, in 49 states, it was somewhat closer. Whether that people think that is relevant or not, just a point for discussion. The Electoral College, where we stand now, 279 for Biden, 217 for Trump, probably heading towards a 306 to 232 victory for Biden, which, as many of you remember, is actually a flip from where we were in 2016, when Trump got the 306 electoral votes and Clinton got 232. We still are waiting official results from North Carolina, Georgia, and Arizona. I was speaking to a friend of mine in North Carolina and said North Carolina should be able to declare its votes tomorrow. Georgia is going through a hand recount, so we may not see those official tally until next week. Arizona, some of the networks have called it for Biden, some haven't. He has about a 12,000 vote lead right now, with about 98% of the vote in. I haven't really heard of anybody who thinks that that Trump can catch him in Arizona. Biden flipped 5 states from 2016, Arizona, Georgia, most likely, and then Pennsylvania, Wisconsin, and Michigan, definitely. He improved his percentage in 38 of the 50 states. So he outperformed Clinton in over 3/4 of these states. His biggest gain was actually in Minnesota, where he did 9 points better than Clinton. His biggest loss in margin was actually, believe it or not, in New York, where as of now, he's running 7 points behind Clinton, although I think that will change because New York's votes are still coming in, but he still may underperform Clinton in New York. Probably most importantly, of the 11 swing states, Biden outperformed Clinton in 9 of them, and arguably the margin in Ohio was just 0.1%, so that was pretty close. The only place where he saw a significant drop off in a swing state was in Florida, where he actually very much underperformed what Clinton did, or Trump overperformed in 2020. And I think you can show that is primarily because of Dade County, where he lost a net 200,000 votes to Clinton. In fact, Biden actually won 2 extra counties that Clinton didn't win in 2016. Biden also did very well in what I'll call the light blue states, New Hampshire, Virginia, Minnesota, and Maine. One other thing that's kind of interestingly similar to 2016, in 2016, Clinton would have won if you could have knocked out 70,000 selected votes from Trump's total. And I am running out of time quickly. That's pretty much the same for Joe Biden, too. If you could knock out a select 68,000 votes in Wisconsin, Arizona, Georgia, the outcome of this could have been different. Quickly on to the Senate. Right now, we're looking at 50 Republicans, 48 Democrats, with Georgia 2 sets seats left to be decided in January. Dems had hoped to pick up a lot more seats, but a little bit of a disappointment. So right now, to paraphrase Tim Russert, it's all Georgia, Georgia, Georgia. There's only been one poll that I'm aware of. It was done by a Republican firm, and it shows Perdue up by 4 points and Loeffler up by 1 point. So it's very close. In the House, we had 233 Democrats and 202 Republican seats going in. Right now, where we stand is 218 Dems, 204 Republicans, with about 13 left to be decided. Republicans are up in 9 of those. Democrats are up in 10, but some are very close. Democrats do tend to catch up. So I suspect we're probably looking at a House that is somewhere around 225 to 210. So the Democrats will control the House representative next Congress, but it'll be a pretty close margin. As of now, the Dems did not beat any sitting or incumbent Republican member. And with one exception, all the Democrats who lost their bid for re-election were freshmen. So not a lot of movement in the House. Just going to state houses quickly, because it's important. Republicans picked up 1 governorship in Montana. So now we have 27 Republican governors and 23 Democratic governors. In state houses, Democrats had wanted to make a big play for this. They really fell short on this. The only state houses which changed were New Hampshire, where both the state house, the state assembly, and the state senate switched from Democrats to Republicans. And then finally, looking towards 2022, because it's never too early to start looking to 2022. I'm already getting fundraising emails. The picture is very different in the House and the Senate. I think the Democrats are going to have a very tough time in the House, whereas the Senate map looks a lot better for them. So I'm happy to take any questions or get into any further details on any of these subjects, but that's sort of a very quick recap of everything that's happened in the last 9 days or so. So thank you very much.
Wow, Ross, that was terrific. You covered a lot of ground really fast, and I think gave as complete an overview as you would have gotten on 48 hours of watching CNN. So thank you very much for that.
I don't have Steve Kornacki's big board.
Let me sort of shift gears here a little and ask you, Wafaa, turn to you. You know, with COVID-19, I sometimes find it hard to believe that it's only been 10 months since this crisis really began last February, I guess it was. It feels like a lifetime ago. It's also the case that, you know, as Ross said, we're in a situation now where perhaps the Democrats will control the Senate, perhaps they won't. But even if they control the Senate, even if they happen to win both of those votes, both of those elections in Georgia, it's a 50-50 tie, and it's the odds of gridlock in the Senate, you know, could well be with us. So it's not clear what a Biden administration is going to be able to get through Congress. We'll have to see. The story of COVID is both a bad news and a good news story, it seems to be. You know, there's a second wave going on in much of the United States right now, around the world. You know, we've got almost 1,000 deaths a day here in the United States. We have well over 100,000 new cases a day. There's talk of promising results with vaccines. So there's a lot going on in the world of COVID-19 and in the public response here in the United States anyway to COVID-19. Let me ask you, when you look at an incoming Biden administration, what would a Biden administration be likely to do, both legislatively, if it can, but also through administrative authority and the executive authority, if it can't, you know, that would be different from what we've seen over the last year from the Trump administration. How do you think things are going to look differently from your perspective when it comes to policy around the COVID-19 pandemic?
Yeah, thank you very much, Michael, for the opportunity to discuss the COVID situation today and what we can look forward to in the future. I have to start first by really acknowledging that the response has been a total tragedy and a disaster. And in many ways, it's been a national embarrassment. With what I see from my own contact with countries around the world and our teams around the world, is that this has really shredded our reputation and the reputation of some of our most you know, traditionally well-respected institutions like the CDC, for example. And why is that? It's important to ask the question why, and then we can talk about what should be done in the future. I think one of the key reasons why we've had a disastrous response has been because our response has had all the attributes of a doomed response. For example, there is no plan. There is no national plan for confronting COVID, and that's should be the number one agenda for the Biden administration, is to put together a national plan that would be would guide everything that goes on from now on in terms of responding to the different facets of the COVID epidemic. So that's number one. Number two is it must be evidence-based. And the problem has been that our response has been erratic. It has been sometimes not based on evidence and not based on science, and that has not served us well. It has resulted in loss of confidence by many people in the response, and has also, again, shredded our reputation around the world. Number three is that it's been led, the response has been, the voice of our response has been really a political voice rather than a public health voice. So what we've seen is largely an emphasis on that the voice of the people who are communicating have been politicians rather than public health individuals. And that also is a very critical element, is that in an epidemic and a pandemic, the leading voice must be a public health or a health voice rather than a political voice. I think another has been this, the response has been really enamored, or people have been enamored with the private sector, and therefore have neglected, again, the public sector overall and the contributions of the public sector, hoping that the private sector in a very decentralized and disorganized way can come to save us all, rather than having a well-planned response that brings together both the private and the public sector, but that is guided by someone at the top who has a bigger plan in mind. I think another has been there have been many communication gaps. What you want to do in a response to an epidemic is to communicate and communicate and communicate. The communication must be often, and it must come from a trusted voice, and it must always be anchored in evidence, and must also be honest. I think it's really important that people acknowledge what we know, what we don't know today, and always remind the audience that we may know something differently tomorrow, and therefore we might come back with different information tomorrow. And I think lastly, I think there's been no clear evidence, to me at least, of the channels of authority, who's really talking to whom and who's making the decisions. And it's been largely, the response has been largely delegated to different states and different municipalities. And that's what's created the chaos, the chaotic response that we see, where you have different states doing different things. We don't have one approach that is applied across the board. I realize we can't be dogmatic, we can't be rigid. Certainly the plans can be adapted to different realities, but on the other hand, there needs to be a uniform approach. So I think those are all the things that have gone wrong, and therefore naturally that lead to what should happen. And what should happen is we need to have a plan, a well thought out national plan that is anchored in evidence, that takes into account where we're at today and thinks out of the box as to how we will get from here to where we want to get to by a certain time frame, and to have very clear lines of authority, and also with clear milestones and deliverables, so we can measure our response and determine whether we're on the road to success or whether we are not meeting our milestones and need to change course. I think it's very important to, again, have leadership of public health, the voice of public health as the voice that communicates to the public, and that it does this consistently, and that the politicians are informed by public health. They may speak on the topic, of course, but they should take their key messages from leaders in public health. And in terms of, and of course, and you can imagine, of course, all the other, the need for bringing together, like I said, the diversity of talents and in this country that are both in the private sector and in the public sector. And lastly, you have to engage the community. And that's been a big gap in the response. We have a major problem in our country where, again, COVID-19 has shined the light on the disparities, and we have now segments of our population who've been more severely affected and are more distrustful of the research community, more distrustful of a potential vaccine, and so on. And this is a great tragedy. So involvement of the community is going to be very, very critical. In terms of looking ahead, I'm not sure. I think a lot can be done by really who are going to be the leaders, who are going to be the leaders at CDC, who are going to be leaders at HHS, who are going to be the leaders of the COVID-19, and we know who the leaders are of the COVID-19 task force, and what authority is going to be given to them, and how they're going to function, what's their scope of work, how visible will they be, how much are they really guiding the response, and so on and so forth. So this just summarizes to me all the lessons learned from the catastrophe that we've been living through over the past 9 months.
That's great. That's great, Wafa. Let me just ask one follow-up question, and then maybe we can get a question or two from the other panelists if they have one. I think many, if not most of the things that you talked about, a new administration can do without going to Congress.
Correct.
And it can communicate effectively without going to Congress. It can listen to science without going to Congress. It could develop a plan without going to Congress. It could, coordinate PPE nationally and use the Defense Production Act. There's a variety of things that a new administration could do without going to Congress. It seems to me the one major thing that potentially you need Congress for is an economic stimulus bill,
Right.
legislation to sort of help people deal with the economic consequences, assistance to the states, assistance to hospitals, assistance to people out of work. How critical is getting something through Congress around sort of a large, economic recovery bill at this point? And what do you think the likelihood of something like that is going to be?
I think it's absolutely critical. I mean, unfortunately, the current administration has pitted public health against economic health, and that's put us in the bind where people are abandoning some of the, the preventive measures that we know work because of they've been told that this is against their own economic health. And I feel like there's an urgent need to be able to economically sustain people who have really suffered. And this includes not just individuals, but also states and municipalities like New York State and New York City that really have suffered. And this is, the interesting thing is now almost every state in this country is suffering because of COVID-19. I mean, early in March and April, it was more New York, Massachusetts, East Coast states. I think now I'm hopeful that there will be momentum and consensus because everybody's suffering. Everybody needs the help. Is that will hopefully bring together the disparate sides of the aisle to say we need to do something because it will be for everybody's self-interest in a way.
Right. Let me turn to the others on the panel and ask if anybody would like to ask a question about COVID at this point.
Well, I'll just a comment, Michael. It was interesting, though, in the debate over the stimulus, the biggest impediment, well, certainly the White House that's a big impediment, but the biggest impediment was actually the Senate Republicans. The White House wanted to do a deal. The House Democrats wanted to do a deal. It's the Senate Republicans who were, dragging their feet, if you will, or putting forth proposals that, really didn't have a chance of passing. It should be interesting to see if Senator McConnell changes his tune now the election's over, although we still have to go into Georgia. But, we talked about Republicans versus Democrats, but we actually kind of had Republicans versus Republicans in this a little bit on the debate over the next stimulus package.
Yeah, no, I mean, I think it's going to be a really interesting, actually, it's going to be interesting not only in, after January 20th and when the new administration, but it's going to be interesting to see what happens during the lame duck, session in these next couple of months. Is McConnell and Pelosi, because Pelosi has a little less leverage than she did. She's lost half a dozen or more members in the House.
Yeah.
Well, McConnell arguably could get a better deal for himself before the Georgia election, where he's clearly got, a majority in the Senate. So I think there's going to be some interesting dynamics during the lame duck session, and then we'll have to see what happens, in January and beyond. I think it's really going to be complicated.
Okay, to make a couple comments.
Absolutely, Jeff. Go right ahead.
So, I think I agree with absolutely everything Wafa said, and I think the point Ross just made is really important to consider because there is this false dichotomy that there's been posed that you either do something for the economy or you do something to thwart the virus, and it's really not the case. If you look around the world, you can see that the countries that have controlled the virus are the ones whose economies are coming through this pandemic the best. Mm-hmm. And you actually need to crush the virus if you're going to maintain an economy. So there's an actual laid out sequence, I think, at this point that's fairly clear. So if we can't find a way to get past the Senate Majority Leader, then we're going to have a bit of a problem. And I also think it's important to recognize a few other things. One is that we do have another 2 months before the president-elect would get sworn in, and we are in the teeth of the outbreak thus far. I mean, it is worse than it has ever been, and we're coming up to Thanksgiving, and there's every indication people are traveling. They're going to be getting together with their families in groups of 6 and 10 people. College students are going back home to see loved ones. We're going to see what the Canadians saw, unfortunately, which is a spike 2 to 3 weeks after their Thanksgiving. And if we see that now on top of what we have now, which is 140,000 cases a day, we're looking at something particularly detrimental. I think one other thing about the communications that's really, really critical is we have to have some expectation management communicated by the president-elect's team once they're in office, which is that this is not something that we're just going to be done with, that we all have fatigue and that we have to recognize that we're going to have to continue with the control measures, the non-pharmaceutical interventions, even as vaccines begin to roll out, and that we have to have that mindset and we have to have that leadership that allows us to go forward and deal with it. The other critical hard point is that it's going to be difficult for Biden to communicate to everybody in the country because we have such a divided means of getting information, and we don't have a common evidence base. In some sense, one might argue that a Republican president has an advantage, particularly if they have Fox News and Breitbart in their corner, that they can speak there and they can also get picked up by the so-called mainstream media. This may be a little bit harder for a Democratic administration to actually get past the pundits on a place like Fox News and communicate the importance of wearing masks and the other measures that need to be implemented.
No, I think the tragedy of the politicization of mask wearing, et cetera, is just a tragedy that's going to be with us for a long time.
That's for you. Yep.
All right. Speaking of tragedies, we're going to switch from one tragedy to potentially another tragedy and think about ways we can improve it. Jeff, coming right back to you, one of the first things that President Trump did when he took office relatively early on was pull the United States out of the Paris Climate Accord. He's never fully accepted the scientific consensus around climate change. And he spent the last 4 years, presiding over an administration that seemed determined to eliminate environmental regulations and oversight and protections, and instead encourage this kind of laser-like focus on responding to the wishes of large industry members. Clearly, President Biden in this arena is going to have some challenges as well, but clearly he starts from a very different place when it comes to climate change. During the campaign, he straddled a little bit on issues like fracking and so forth. I mean, I think he was not quite in the quote unquote progressive Democratic camp, wanted to maintain his role as sort of a moderate on some of these kind of issues, quote unquote. Tell us a little bit about sort of what you think might be feasible, might be likely, you might expect to see happen in a Biden administration when it comes to environmental regulation and climate change.
Well, I think first and foremost, when he gets in there by executive order, he's going to undo a lot of the executive orders that Trump put in place. As a matter of fact, all of them that he can. He's going to have to clean house a bit, which is his prerogative in places like the EPA and some other agencies where the government has gotten a little too cozy with industry. He's going to have to separate it by really bringing in partial people who are going to work from an evidence base. He has to also restore career civil servants and scientists, not their authority, but the respect that they're due and their authority to actually act in a unsuppressed way. Let's put it that way. Maybe I'm struggling for words for it specifically. And that will have a large trickle-down effect. That's going to come down to the funding agencies. That's going to come down to the way the reports are issued. That's going to come down to the way we engage with states and industry around the country and internationally. The day after the election, we pulled out of the Paris Accord. It's almost ironic, but that was the date that we could do it. My understanding is that within 30 days of saying you want to go back into the Paris Accord, you were back into it. So I imagine that will be something that gets done by executive order on day one of a Biden administration. I think the problems are going to be ongoing, though, because there has been a lot of almost psychological damage to civil servants and scientists that work within the government. And restoring that and bringing that back and bringing the talent pool back is going to be a considerable challenge going forward so that we can have effective policy. Now, Michael, I know you follow this more than I do, and I think you could speak to it as well. But I see this as something that's going to take a time to heal as we move forward. There also has to be, for the scientists who are presenting the evidence base, a real sense that they're not being censored. And that is going to have to go forward, not just by the career scientists within the government, but those who are funded in industry and academia, that they can speak freely to the research that they want to do. For the issue of climate change specifically, and climate and health, if we were to think about it, the truth is there hasn't been, for climate and health, a lot of federal funding for it. It's a burgeoning field, and it's something that federal agencies and funders have not been able to get their heads around. And I'm very hopeful that they'll continue to work at this so that we can think of sensible, concerted, and important problems to address scientifically that are going to improve the lives of people around us and help solve and mitigate the climate issue. I think more broadly, we have seen a gutting of it within the NSF, and that has to be restored. Congress has a big role to play with that as well, because they sometimes play around with it and line items about what funding can go to within certain federal funding agencies. That too, we will have to see how much the president can actually adjust and how much he's going to have to get along through cooperation with Congress. I think the main place where we're going to see some real cleaning, though, is certainly with issues that went on within the EPA. We saw a lot of movement to gut the clean water and clean air provisions and to roll back policies that were in place there. We need to shore those up. There has been so much work that has been done from schools of public health, in places like my own department, environmental health science, to support regulations in terms of levels of exposure and what is acceptable, and providing evidence of the health importance of doing those. And these have been almost willy-nilly in the face of repeal and pressure for repeal. So seeing that shorn up is really going to be a critical first step out of the gate, I think, for the Biden administration, and probably something they can do fairly expeditiously.
Great.
I'll stop there.
Thanks, Jeff. Terry, on this subject, I know you lead work in your department and a group around environmental justice. Maybe talk a little bit about, following up on some of Jeff's comments, your thoughts on sort of Biden and an environmental agenda and environmental justice, and what you mean by that, and what the likelihood is that we're going to make progress on it going forward.
So, I mean, I thank you, and thank you, Jeff. I mean, I think, industry has found a way to gain major exemptions in a lot of the protections that exist. So, for example, hydraulic fracturing is exempted from all kinds of reporting requirements. What we have seen is that there's a disproportionate tendency to place toxic waste facilities, to do fracking in low income or communities of color. And so there are extreme consequences as a result. I think that repealing the regulations is one piece of it, but also this issue of public health infrastructure. We lack the capacity now to even, capture some things like lead in the water in Flint, right? So there are a lot of health consequences, low birth weights, heart defects in newborns related to, exposures that are understudied. There's not enough funding for it. So I think the issue of justice around who bears the brunt of environmental injustice have to be centrally addressed by the Biden administration. And just one very obvious example is, because of the law, the traditional tribal law, indigenous populations have really been a place that industry have focused a lot of their work, because it's much easier to gain access. So you see a lot of health consequences around the country and the world related to, inadequate regulation of extractive industries.
Right. Yeah, the fracking question is going to be a really interesting one. Clearly, Vice President Biden, probably an effort to make sure that he didn't lose Pennsylvania, which it looks like he's going to squeak out, was pretty clear that he was not, he was potentially going to ban new fracking on new federal land, as I recall, but he was not going to be coming out sort of with sort of an anti-fracking agenda more generally.
Michael,
Go ahead. Do you want to add?
yeah, on the fracking issue, in the last debate, it was supposed to be the third debate, it ended up being the second debate. It's all like you can make the case that sort of Vice President sort of fumbled his response to that question. Things are a little confused. I don't think he paid any price for that, but I wonder if the Democrats in the House paid a price on that. They had big plans of picking up seats in Texas. They got nothing, and they lost 2 seats that they had. Congresswoman Torres Small in New Mexico, Congresswoman Horn in Oklahoma. In energy states. Those margins were not razor thin, but they weren't huge. That could have been a drag on Democrats in some of those states.
It's interesting. I mean, I wonder, this is one of the issues. I mean, the environment, probably all of these issues, but clearly this is one of these issues where President Biden is going to be navigating a sort of a moderate 50-50 at best, Republican Senate with a progressive wing that's pushing very aggressively for much more ambitious proposals around the environment and a quote unquote Green New Deal, et cetera, et cetera. I mean, to Jeff or anyone, the politics of this, I think, are going to be tricky for President Biden as he tries to navigate his way through these swirls around him.
Yeah, I think that's absolutely correct. And I think, there is a rational position here where we need some form of regulation. Even, we're now in a regulation-free zone and there are severe health consequences. So I think it's manageable. It's kind of a catch-22 though, because as Jeff indicated, there's not been a lot of funding to document the health consequences, right? Particularly by a politicized EPA. So we have to also in public health sharpen our skills here and make sure we're in the conversation.
So is this one of those cases also like when we were talking about COVID, the false dichotomy between the economy and public health. I think when it comes to the environment, President Trump and others have created what feels to me like this false dichotomy between economic progress and environmental regulation. And I think that President Biden has to try to do, and I sort of throw this out there, is to say, just as we're not going to solve an economic crisis until we solve the public health crisis, to say we're not really going to be able to prosper economically if the world is falling apart because of climate change, and that we can actually have a climate change policy that is good for the economy, or at least good for significant parts of the economy.
Well, that's the basis of the Green New Deal, which is a very progressive point, but he's got to find a narrative that's going to work for him. I totally agree that his position on fracking has been a political calculus. And how it's actually worked is hard to say, because you look at what Trump has done and he's been all over the place. He tried to prop up coal industry early on in his presidency and made it a big selling point. Yet we know that there are an enormous number of jobs that have been created in places like Oklahoma by wind energy and other clean energy. So there are people who are feeling the immediate impacts of that transition that is already taking place within this country. And there are more jobs in that sector. So the question is really what's going on here. And I think from my perspective, it's a little difficult to dissect. It's a little difficult to tell, but he needs to control a narrative here, find out what people are really after and want, and make sure they understand that green jobs are jobs. They will help the economy go forward in a sustainable way, not just sustainable for the planet and its environment, but sustainable for the economy.
Right. All right. We could keep talking about each of these issues, and I kind of wish we could, but I want to just shift gears a little bit again. And Terry, turn to you to start us off. There's a lot of discussion these days and a lot of concern about the fact that we now have a more conservative Supreme Court, a court with 3 appointees, by President Trump. And what's that going to mean for the right to reproductive health for women here in America? And also, what is that going to mean for the right to provide reproductive health services to clients by healthcare providers and organizations, both here in the United States, whether it's Planned Parenthood, et cetera, or groups around the world? Maybe talk to us a little bit, Terry, about what you think a President Biden administration can do to try to assure women that their right to reproductive health and access to, good reproductive health services of all sorts, including an abortion, could be protected in a Biden administration. And internationally, maybe also talk a little bit about the global gag rule and sort of what that's done, in terms of our work internationally. Terry, let's start with you on that.
Okay, thank you. Thank you. And it's a pleasure to be here with all of you. I just want to, it's a great group. I have to say that we have research globally and domestically, and documenting the harm that's been done. I think that the Trump administration really devoted itself to disrupting access to sexual and reproductive health. So one obvious example is the global gag rule, which has been put in place since Reagan by every Republican president, overturned by every Democrat. It basically limits anybody who in the past received family planning assistance from the US from even referring to abortions, and it specifically applied to foreign NGOs. The Trump administration expanded that so that it was attached to all global health assistance, and also made sure that it also attached to sub-grantees of institutions that were receiving global assistance, even if the sub-grantee got no US money. So we have seen really terrible outcomes related to this. We've spent years trying to integrate sexual and reproductive health into health systems and integrate HIV, and suddenly we had, because of a very serious potential loss of funding, severance of all these different services, clinics closing, really big abortion providers who also were providing a lot of other services having to close. So that has been really catastrophic, and that's something that Biden can immediately rescind by executive order. There will be, there's a lot of damage done, more so than any other time. And by the way, there has been no decrease in abortion. There's been an increase in unsafe abortion. So there's that. He did the same domestically. He attached a gag rule to our Title X funding, which is the biggest source of coverage around sexual and reproductive health for uninsured, low-income people. 6 states lost Title X funding completely. So we've had a really bad problem in many states with healthcare deserts being created by this. He can also fix that problem. The Supreme Court is more complicated, as you well know. First of all, President Trump has stacked the courts, so there's not that many federal court vacancies right now. So we have a judge problem. I think at the Supreme Court level, we're more likely to continue to see the chipping away of Roe v. Wade rather than the outright overturning of Roe v. Wade because of Justice Roberts' belief in precedent. But there have been like 450 restrictions introduced over the last few years. So this will continue to be a huge problem. They would need more votes in the Senate to pass a law that could protect Roe v. Wade. So I'm feeling less optimistic about that. There's a lot of things that they need the votes to be able to do. But I think just not having the US's role in WHO and every other UN entity to be policing to make sure nothing mentions reproductive health and reproductive rights is going to be a huge change and very important. So I think we're looking at a much better picture, but certainly not perfect.
Great, thanks. I have a follow-up on this for Ross and then one for Wafaa, actually. Ross, to the extent that there is continued chipping away at the protections of Roe v. Wade and a continued shifting to the states of basically responsibility or authority to set restrictions around abortions, I think you said that the Democrats didn't do so well in many of the battles in state legislatures this year. So do you see a trend toward more conservative state legislatures as well? And what do you think that might mean?
Well, it's not so much that I see a trend towards more conservative legislatures. It was more so the Dems had hoped to make gains and didn't. So I didn't look at the exact numbers, but it didn't move a lot. The needle did not move a lot in either direction. So whatever it was, prior to November, it's probably going to move ever so slightly to the right, if you will. And I don't know whether those are moderate Republicans,
Right.
conservative Republicans. I don't know. But as that's Terry is right. I mean, the story of the last, I guess, 47 years now is attempts to overturn Roe v. Wade, but these attempts to chip away at it, and that's why you get 50 separate, abortion laws across the country. And certain states will try it, certain states will not. The Supreme Court will probably put up less of a blockade than they had in the past. But I think, and Terry alluded to this, the issue is what happens if they do overturn Roe v. Wade, or if the Biden administration wants to do a national abortion rights bill. I think it would have to be, and I don't mean this in any bad sense, but it have to be a fairly, I wish I could come up with a better word, but timid or basic attempt to provide. They couldn't be a very aggressive law, because even if the Democrats have the majority, yes, there are a couple of pro-choice Republicans, but there are also a couple of pro-life Democrats. So you'd have a real tough time holding your 50 votes, and then Vice President Harris would break the tie. So you really got to be careful that you wouldn't do anything that would scare off Senator Manchin, I think Senator Casey's even a tougher vote to get on any sort of abortion rights bill. Not to say that wouldn't be, effective, valuable, helpful, but it'd have to be, like I say, a fairly, again, I wish I could come up with a better word, non-aggressive or not widespread or far-reaching bill to have any chance of passing on a national level.
No, that makes sense. And I think any chance of overturning, for example, the Hyde Amendment, which restricts, federal funding for Medicaid abortions, is pretty much out the window at this point.
I think that's out the window. They could see some loosening up on abortions in the military, because that's something they've had some more flexibility on. And then I have a lot of friends who work for the federal government, but also for federal employees, about whether or not federal employee health coverage will cover these types of services. That's always a seesaw back and forth depending on who's in control of the administration.
That makes sense. Wafa, let me ask you, you have, ICAP has sort of, clinics and organizations you work with around the world, particularly in low-income countries around the world. Could you talk a little bit about the impact of that you and your colleagues have seen, in terms of what Terry has said around the global gag rule, and sort of what kind of a difference it might make if that was changed?
Yeah, I mean, I think in many of the countries where we work, this work, what Terry's talking about, is absolutely fundamental to women's health. And often these women are dependent on the services provided by specific organizations. And many of these organizations are dependent for survival on external funding, and largely US funding. So I think while some other funders have stepped in, like sometimes European funders have stepped in to try to fill the gap, still the US, the restrictions on US funding is really profound in terms of the survival of many of these organizations. This doesn't apply to the funding going to governmental organizations. So at least that's at least a small piece of good news. It only applies to non-governmental organizations. But in many countries, those are the organizations that are out there in the community, that are trusted by the community, that have a lot of large volumes of women coming for women's health and sexual health services. So it's absolutely critical to women's health and women's survival around the world.
All right. Any last words from anyone on this topic before we
I think also,
gears?
I mean, it's important that we, in many ways, we tend to think women's health and we think HIV, then we think something else. And in reality, a lot of these organizations are, like the work we support is both HIV and women's health, and these other organizations are doing women's health, but they're also doing HIV testing and so on. So these restrictions have spillover effect way beyond the very kind of narrow interpretation of these restrictions themselves.
Great, thanks. All right, I'm gonna have a shift gears again from sort of a a focus on one aspect of healthcare, sort of sexual and reproductive health, sort of the question about affordable access for all Americans to high quality health insurance and healthcare coverage. And I'm going to switch my role, my hat anyway, for a moment from sort of a moderator hat to a panelist hat and spend a couple of minutes talking about this issue myself. Clearly, one of the goals of the Trump administration over the last 4 years was to sort of ratchet away at and slash away at public insurance programs here in the United States. There was a sort of fierce effort to repeal the Patient Protection and Affordable Care Act that came fairly close to sort of, imposing some real harm, but the ACA survived. But there's been continual legal challenges to the ACA, most recently oral arguments just this past Tuesday, just a couple of days ago, on the latest constitutional challenge to the ACA. My guess is, and I'm happy, in Q&A to sort of talk about, the constitutional issues in the most recent litigation around the ACA. My guess is, and from what we saw during the oral argument, the ACA is likely to survive this most recent constitutional challenge. But while the ACA is likely to survive these challenges, there's been a 4-year effort to sort of minimize the number of people who receive benefits and services under the ACA. There have been cutbacks in marketing, funding for marketing. There have been significant efforts to try to offer very limited benefit plans that really contravene the intent and goal of the ACA, sort of low-cost, minimal benefit plans, and allow individuals to buy those instead of the more robust plans that you would get through the Affordable Care Act. So there have been lots of efforts. There have been efforts to cut back Medicaid coverage significantly through efforts to reduce immigrant eligibility for Medicaid, through efforts to impose work requirements on Medicaid. So actually during the first 3 years of the Trump administration, for the first time since the late 1980s, the number of people on Medicaid in the United States declined by about 3.5 million. And that was the first time, we'd seen increases in the number of folks on Medicaid under Presidents Reagan and Bush and Clinton and Obama and George W. Bush, et cetera. But so there was been this fierce attack on public insurance programs. During the primaries, clearly the Democrats split on the best approach to take. You had obviously Bernie Sanders and the more progressive wing pushing for sort of a Medicare for all type approach. Vice President Biden was saying, no, we don't want to sort of go that far, kind of like similar to the debate around a quote unquote Green New Deal. And instead, the vice president proposed three basic planks. One, he's proposed sort of stabilizing the ACA, restoring some of the funds for marketing, getting rid of some of the limited benefit plans, shoring up the Medicaid program, et cetera. Number two, he has proposed lowering the Medicare eligibility age from 65 to 60. And number three, he has proposed creating what is called a so-called public option, or a new federally administered public insurance plan, which would actually be available to all Americans, whether they now get their coverage from an employer or they're uninsured or whomever. They would have the ability to opt in to this so-called public option. So it was really, those are the three planks that Biden ran on essentially during the campaign. Given the results of the recent election, I think it's, number one, it's clearly possible for a President Biden, as in the environment and as in COVID and as in reproductive health, all the issues we've talked about, to make some administrative changes, executive orders. I think he could give more money for marketing, programs under the ACA. I think they could actually get rid of many of the limited benefit plans. They could change the Justice Department's views on a lot of the litigation around the ACA. So there are some administrative actions that I think that a new administration could take that will be important and will make a difference. Legislatively, it's going to be, I think, nearly impossible to get some of the kind of things through, even if the Democrats take the 2 seats in Georgia. I think, the opposition to a public option, at least as the public option is being framed right now, will be fierce from the provider community and from the insurance community, largely because what a public option means is that providers, hospitals, doctors, et cetera, essentially will be paid at public insurance rates, which are significantly lower than commercial insurance rates. So any effort that results in shifting large numbers of Americans from commercial private coverage into public coverage is fiercely opposed by providers, by doctors, by hospitals, et cetera. And I think stands not that, a very little likelihood of actually success. We don't know. We'll have to see how it plays out. I mean, even if it's 50-50, it's possible that one could get a Susan Collins or a Lisa Murkowski or, one or two Republicans to basically sign on. But I think it's a very tricky calculus. And I think a public option, if enacted, won't look like the public option that was proposed during the campaign. So there'll be politics about that. And similarly, the idea of lowering the Medicare eligibility age right now from 65 to 60 is going to actually run into very dangerous waters politically, particularly at a time when the actuaries are now coming out and basically saying, that given sort of changes in sort of the funding of the Medicare Trust Fund, the fiscal viability of the trust fund, and when it starts to become unable potentially to pay its bills, it's actually going to happen sooner rather than later. So there's going to be a lot of talk about a Medicare cost crisis. And in the context of a conversation about a Medicare cost crisis, I think the idea of expanding coverage to Medicare is going to be a tough road to hoe. I do think one thing that is possible to happen legislatively, there's a couple of things that I think could happen legislatively. One, I think you could get support in a bipartisan way to increase subsidies to people to buy private products through the exchanges under the ACA, and actually to potentially reduce the deductibles that people have to pay under the ACA. So I think there's room for compromise there. I also think you could see compromise around so-called surprise billing, episodes in which you go into the hospital, you pick a hospital that's in your network. You think, I'm doing good. I picked a hospital and a surgeon in my network. I'm to be applauded. I'm following the rules. But then it turns out the anesthesiologist who conducts who puts you to sleep was not part of your network, and you get this huge bill. So there's a big debate about so-called surprise billing. And I think there could be bipartisan support for some legislation there. And potentially there's, I think, some bipartisan support for doing something about the high cost of certain prescription drugs. Although I think, getting back to COVID for a second, I think if it turns out that the Pfizers of the world emerge as sort of the heroes of COVID because they've developed the vaccines that save America from COVID and save the world from COVID, and some of the other pharmaceutical companies, I think it's going to be the political appetite for cost cutting in the toward the pharmaceutical industry is going to be a little bit tougher, because I think their view, the sort of perception of the pharmaceutical industry is going to actually go up again. Where I think previously they were viewed in something of a negative way. Now I think the politics of that are going to change a little bit. Anyway, that's just a little bit on, I think, the politics of health insurance. I'll ask my fellow panelists to be the moderators and just see if they want to follow up either among themselves or if they want to add anything on this issue around health insurance. We actually, I should look, there is a question I see from Bronte Kastenberg on the Q&A, saying there have been rumors that certain Supreme Court justices believe that the ACA is constitutional, but they're interested in rolling back aspects like the financial penalty for those who did not enroll. What do you think of the implications? Any other thoughts about the future of the ACA? Okay, well, I think I kind of answered hopefully most of that question during the conversation.
Well, Michael, can I just chime in here?
Absolutely.
This question. The financial penalties have in effect already been repealed. That was part of the Tax Cuts and Jobs Act, probably the least imaginative name for legislation you've ever heard of, in 2017. So that bill, it technically did not repeal the individual mandate. It just revealed the penalty, if you will, for not getting insurance. And this has turned out to be one of the two major constitutional issues in the court case that was argued on Tuesday. So that has already been done. The fear when that happened 3 years ago that it would cause, and the people on this call who know more about this than I do, but that would cause the insurance market to implode because people were not required to get insurance, yet there was still the requirement for coverage of pre-existing conditions. I think it's fair to say that disaster scenario has probably not happened.
Right.
And in some ways it's ironic because in terms of whether this is severable from the rest of the law, whether the rest of the law could stand on itself, may have, strengthened that argument. The idea is that the Affordable Care Act continued to function even without this provision in it.
That's a great point. And that point, Ross, was actually echoed by one of the most conservative members of the Supreme Court, Justice Alito. Justice Alito, during oral argument.
He and I have a lot in common,
Excuse me?
He and I have a lot in common,
Yeah, I figured. But Justice Alito actually said, well, the law seems to have done pretty well. At least it's survived the last couple of years. So it could well be that I think this decision is not going to be, while there was fear that the entire ACA was going to be struck down among some, I think this decision, if not unanimous, could be, more like a 6-3 or 7-2 or even more decision than we thought.
And just one point of clarification about this. In the original case of NFIB versus Tobias in 2012, the Supreme Court did something very tricky here. They, in fact, ruled that the individual mandate was unconstitutional. But they also ruled that the mandate wasn't, in fact, a mandate, it was a tax, and therefore was constitutional. And that's what's led to this issue, in this most recent case.
Well, I think they didn't rule that, not to disagree, they didn't rule that it was unconstitutional. I think 5 of the judges said it was not authorized under the Commerce Clause. 4 of them said it was authorized under the Commerce Clause, and then Roberts said it was authorized under the General Taxing Clause.
So, yeah.
Right, but I think you're absolutely right.
Yeah, better explanation.
I want to shift gears. Terry, were you going to say something on this?
I think Wafa also had.
Sorry, good. Okay, go.
Wafa first.
I think it's a question to you, Michael. You mentioned that if we get a successful vaccine, that may shift things towards more sympathy for pharmaceutical companies. What do you think the whole COVID epidemic, what potential impact it might have on the other side? Is people realizing they could be kind of economically devastated and from one health catastrophe? I mean, could that be a force moving in the other direction?
That's a great question, Waffer, and I wish I knew the answer. It's really hard to know. I mean, COVID has, as we've talked about, as you've talked about, has become so politicized, in how we respond to it, that you have a lot of people, even though there's, 140,000 cases a day and 240,000 deaths already, or 1,000 a day, there's a lot of people who we're a country of 330 million people or whatever it is. And there's a lot of people that either don't know anybody themselves who's
hasn't
died,
touched them specifically,
or if they know a person who had a case they got better very quickly. And so if their political leanings to begin with are sort of, to sort of be skeptical of government, skeptical of science, until and unless something hits home, it's not clear to me how much the politics of this is going to change. And so I just don't know. Jeff, do you have a thought on that? I mean,
I'm going to defer to Terry first because she wants to say something. Terry?
I'm sorry, just very quickly. I just wanted to say, the U.S. has not been a participant in the COVAX effort to make, to make sure that every country gets a certain amount of vaccines. I think that the underside of the, Pfizer being a heroes is we know very little about the deals that are being made. We know very little about cost always, right? And around the world, since the early days of HIV, we've come a long way in using compulsory licensing and other ways to make sure that drugs, vaccines are affordable. So it's a very interesting space to watch because Biden hasn't said he's joining COVAX.
Interesting. I didn't know that.
Yeah. So anyway, sorry. Go ahead, Jeff.
Well, I think the issue of people not really knowing somebody who has had COVID and not knowing the impact that it has and not appreciating it, again, talks to the problem that we have in the country that is a really deep one and maybe the most significant one that we don't have a common and evidence base to talk to. There are people who still purport that this pandemic is a hoax. And if their numbers are not small, we have a problem. And we have a problem until we can actually have a common set of facts to work from. And if all we're doing is going down our different rabbit holes, then we're not able to talk about these issues and actually come to some sort of approach to solving problems that's actually evidence-based. And we need that desperately in these circumstances.
I agree. We have a lot more to cover. We have less than 10 minutes to go. One quick question, Wafa, that I'll ask you that we got from Lee Daniel in the Q&A. He says that you mentioned the significant communication issues that we need, and actually this builds off of what you were just saying, Jeff, as well, to address the COVID pandemic. And he says Biden's transition team has a lot of medical, pharmaceutical, and logistical specialists, but does it have strong health communicators? You know, I mean, when you look at the transition team on COVID that, and I say this to Jeff and Terry and Wafa, all of you, that Biden has put together, do you see, I mean, is it going to be Tony Fauci who's going to end up as the lead communicator, or is there someone on that transition team? I mean, who's going to be the voice, the public health voice, do you think here?
I think there are several people that I would say have excellent communication skills, and I think, I mean, one of them is Vivek Murthy, who was the Surgeon General before. He's quite good. He's quite eloquent. He connects with the audience and so on. I think the important thing is that people on the task force are able to mobilize others in the country who can become the spokespeople. I mean, it's just not going to take the 12 or 15 people who are on this task force. It's going to take identifying who are the opinion leaders, who are the champions that can be identified, even in communities that have been adversarial, as you say, Jeff. We need to identify from within those communities people who can be enticed or convinced to take this on. We need to find the spokespeople amongst young people. We need to find amongst the older people, amongst people who are evangelical and so on. I think without reaching every community and trying to do the hard work of identifying those trusted communicators, trusted people from those communities, we're not going to be successful. So the task force is just the beginning, but I think it's how they do their work and how they're able to reach within those communities successfully is going to make it, is what will make a difference.
Great, thanks. Listen, we only have 5 or so minutes left, and I really want to make sure that we at least touch on the issue of racial justice. You know, the Biden administration has made clear that it views, I mean, if you go to the Biden transition website, it lists its 4 top priorities, and among them is the priority of confronting and responding to the need for racial justice in this country, and responding to the deeply rooted disparities that adversely impact health. And yet, when I actually look myself at the transition website under racial justice, I see lots of talk around housing and empowerment zones and various policies. I do see they talking about an infectious disease, you know, around COVID, sort of creating a task force around sort of disparities in COVID. But more generally, how do you think, and given the time, I'm just going to open this up to anyone that wants to take an initial stab at it. How do you think a Biden administration can and should sort of begin to address sort of the public health crisis of you know, racial justice in the United States?
I mean, they have to take it on front and center in it has to be central to everything they do. I mean, I think, you know, it's no secret that communities all around this country really came out and helped get Biden elected, communities of color. So I think, you know, it has to go beyond the political circles, right? They've got, exactly as Wafa said, they have to find folks at the community level who really can do this work, can actually help overcome the very understandable distrust of a very politicized, what it seems to be a very politicized health response, right? But I think that it should be central in every single aspect of that transition.
When I think about this issue, Michael, and I agree completely with what Terry said, it needs to be, it's one of those things that can't be just a vertical approach. We're going to focus on it in this way, in this manner. It has to permeate everything. It has to be one of those cross-cutting horizontal kind of bands that cut across every effort that's made by the government and its many different bodies and agencies and so on, national level and local level. So I think I hope that it's really seriously conceptualized as being, it needs to be embedded in everything we do and how we do it. And there's somebody in the room who always raises their hand and raises the issue of disparities and racism in this country. Until and unless it permeates every program, initiative, and is consistently raised across the board, we're not going to be successful. I don't see it as one kind of vertical program that one person is in charge of. I don't think that will make a difference.
When it's certainly the case that all of the issues we've talked about over the last hour, whether it's COVID, whether it's environmental justice, whether it's access to health insurance, whether it's access to reproductive health services, all of them are infused with issues around disparities and race more generally. How this plays out in an administration, that is on the one hand, I think committed to trying to sort of do the right thing in this area. On the other hand, is in a very complicated sort of political environment here in this country. It's really one of the, I think, unknown questions going forward. And I guess that also leads, we have really just a couple of minutes left, to sort of the question about our own public health community. And really what can and should the public health community here at Columbia, but more generally, be doing to try in a new administration, that we weren't maybe able to do as effectively in the previous administration, to encourage the adoption and the implementation of policies that will lead to, a better, fairer, and more equitable system for all. I mean, Jeff, you talked earlier about the role of science and how you thought, there may be an expanded role for science in a new administration. I mean, final thoughts on sort of what we at Mailman and what we in the public health community should really be thinking about right now in terms of creating our own agenda going forward.
I think it's a time in some ways. I think it comes back to communication. I think we have to try to develop the narrative about how public health is everyone's health. And, if you were to come and think about it in the lens of diversity, equity, inclusion, and I completely agree, it needs to permeate everything. There has to be a narrative developed that Black Lives Matter is about the Black community, but it's also going to improve everybody's lives. If we can do that for the Black community, with the Black community, in support of them and in conjunction with them, if we can deal with the systemic institutional problems in our society, we are going to have a healthier society overall that will benefit everyone. And maybe that's a very misty-eyed approach to the whole thing, but I truly believe that is the case. I've seen evidence that that is the case, and I think that is an evidence-based approach. And if we're going to actually promulgate that practice, if we're going to use that evidence base to support practice, we have to have a communication and narrative affixed to it so people understand the why of why it's worth their time, particularly those who might not be, let's say in this instance, in the Black community. So I think that narrative is really important. I think it goes for dealing with reproductive rights issues. I think it goes for dealing with environmental issues. It goes for dealing with the pandemic. It goes for access to affordable care. I think if we don't have this communication there, and if we don't breach the divide that exists in our country and get that communications lines open somehow, we're going to have a much harder time with it.
I mean, I think I agree completely with what Jeff said. I do think I am an optimistic person through and through. And I do think if there's one silver lining to this pandemic is I think people, I believe, have a new appreciation of public health. I'm amazed. I think most people now can sort of have a sense what is epidemiology. They know how to look at it, at the data. They, believe it or not, some may even know what R naught is. So I do, and we'll see it in interest in public health and interest in public health as a pathway to equity, as a pathway to prosperity for everybody and wellness for everyone. So I think it's a great moment for public health now, and we should really grab the moment. And I believe that public health brings two very important things. It brings kind of the analytic aspect of the work, the analytics in terms of whether it be the modeling or whether it be social determinants of health. But we also bring action. And that's really important. Public health is about action. So I think this, to just I hope in our communication that we can highlight the analytic strength of public health and the action piece of public health. And I'm hopeful that now is a moment, and maybe in the new administration, where because of the epidemic, there's a deeper appreciation amongst a broader population of the value of public health.
Just following up on that, I just want to stress the importance of advocacy. It is so important that, brilliant experts like we have here at Columbia, like are on this call. Yes, they do their wonderful work in the lab and they write and they publish, but they need to get that word out. They need to become the voices of science, not just, in our community, but in general. There's a famous saying we have in Washington, attributed to Senator Mike Enzi, if you're not at the table, you're on the menu. Decisions are going to be made, and you're going to be at that table when those decisions are being made. I mean, one of the things I've done a number of times over my years here at Columbia is I've done some advocacy training for faculty and for students. And a biased statement, but I think that does help them become better, emissaries for science, better emissaries for their field, if you will. So just, encouraged to get involved in advocacy, to write that letter to your member of Congress. If we ever do get back to traveling, to make the annual trip to DC or to your state capital. And so I'll just, I think that's an important aspect of this as well. That goes into what Wafa was talking about being a communicator.
That's true. That's great. Terry, do you have a final thought on this?
Oh, I couldn't agree more. And I think we really need to teach our students to communication skills for the next generation. So.
Yeah, we're a couple of minutes over. I think this has been just a really terrific panel. It's been a great opportunity for me to interact with colleagues who I just admire so much and look up to so much. I think, to me, one of the most hopeful things right now, and I do feel more optimistic than I did 2 weeks ago anyway, is I think the president, as the leader of the country, sets a tone for the country. And I think we're about to see, we've already seen in the last week, we've already seen in the last several months, a very different kind of tone. It doesn't mean that the world is going to change overnight. It doesn't mean there's going to be major new legislation, passed through Congress in an instant. But I think the conversation is going to change. The communication is going to change. The dialogue is going to change. And getting back to what a number of you have been saying, part of that change has to be to sort of get rid of these false dichotomies. It's public health versus the economy. It's environmental regulation versus the economy. It's, it's sort of Black Lives Matter versus everybody else's life doesn't matter. Whatever. It's, these dichotomies are sort of false traps that I think we can go down as a country, and we have gone down as a country. And I think a President-elect Biden is, I certainly believe, going to really help to set a tone that's different, a conversation that's different, and I think a really optimistic moment for public health is right now. So I want to thank everybody. I want to thank Terry and Jeff and Wafa and Ross. I want to thank all of the people who participated in the audience and listened and asked questions. I want everybody to stay safe. Have a great Thanksgiving, but stay safe. And we will see you all soon. Thanks, everybody.
Thank
Bye-bye.
you, Michael.
Thank
Thank
you,
you very
Michael.
much,
It was a lot of fun. Take care,
Thanks,
everybody.
Ross. Bye-bye.